Okay, this is my patient Ashley. I've taken her medical history and I have determined that she has diabetes and she takes insulin for her diabetes. So, of course, in our medical history, I would ask, have you taken your insulin today?
I have.
And have you eaten something today?
Yes.
Okay. And we're gonna assume just for this emergency, since we are gonna be doing hypoglycemia, we're gonna assume that she either had very little to eat or maybe she thought she ate and she didn't, so that her sugar levels do drop this emergency. So I'm going to lay her down. And of course, I'm gonna have all my PPE on when I'm actually working on her. I'm gonna buy masks, I'm gonna have my gloves, everything that goes in with that. So I'm gonna be working on her, and I'm gonna notice that she gets a little bit shaky. Okay. I'm gonna step back a second. I noticed you're a little bit pale. Are you feeling okay?
My head hurts.
Your head hurts? Okay. Are you feeling kind of hungry?
Yeah.
Okay. So once I have recognized her symptoms, pallor, and she's hungry, she is shaky, she might have dizziness, maybe confusion. Once I have about 4 of those symptoms, 4 or 5, I'm going to determine that this is probably a hypoglycemic emergency. So the first thing I'm going to do is I'm going to notify the instructor across from me. Hey, excuse me, I think I'm having a bit of an emergency here. Can you please get I will ask for the med cart and the oxygen.
Okay, I'll go get that for you.
Okay. Here's your oxygen.
And I'll drop the med cart as well.
Since she's feeling dizzy, I'm just going to set her up slightly to a semi-supine, slowly, not too fast, just like this, so that maybe the dizziness will subside a little bit.
Okay, so I'm going to go ahead and start by checking her vitals. So we're going to put on her pulse ox on her pointer. I'm going to use this one. Get that going. And we're also going to go ahead and check her blood pressure.
And since we're pretty sure that it is hypoglycemia based on the medical history, the other person, one of the two that's not doing the vitals, would go ahead and administer glucose. Now for our clinic, we have cookie icing, so we would give this to her orally. If she were to just immediately be unconscious, we would need some intravenous form of glucose. We don't have that here, but perhaps like a glucagon injector or something like that. So I would give this to the patient. I would have her have some of that, or I would pour some, on her finger or wherever we need to, and she would put that in her mouth and she would eat it.
And then I'm also going to be documenting this every 5 minutes, her blood pressure and her pulse.
Yeah, vitals. And then if the pulse ox is reading about 93 or less, a pretty low reading, I'm gonna go ahead and get the oxygen over here. While she's doing the vitals, I'm just gonna get the mask out. I'm gonna do the procedure for the oxygen, so I'm gonna, turn it on the correct way, make sure it's the correct pressure, and then I'm gonna, if she's conscious, I'm just gonna ask her if she wants to hold it. Would you like to hold it? Oh, hold it. Okay. I'll give it to her. She'll just place it near her face, and we'll just let the supplemental oxygen go ahead and get her pulse, or get her oxygen levels up a little bit more. And then, of course, if she were to go unconscious, me or operator 2 would just put it over her face. We would probably lay her down supinely and put it over her face and administer oxygen, emergency gas. And then, let's say feeling better, or if she does not feel better or she passes out, then we'll just have to wait for EMS to come and further help the patient.
And when they get here, I'll show them the paper where I've documented it, and they'll see what her blood pressure and pulse was every 5 minutes.
Exactly. And if things start to resolve, and I'll take this away, her oxygen levels are better, put this up, and if she is starting to feel better, let's say the clinician 3 or operator 3, the dentist or the instructor determine they don't need EMS or they do need EMS, either way, if they're feeling better, EMS might have already come or not. we would ask them, are you feeling better? Do you want to finish up the treatment, or do you want to just reschedule?
I think I'd like to reschedule.
Okay, so she'd like to reschedule, so we would remove her.
Go ahead and dismiss the patient.
So you're busy and then lost. Yeah, and then see. And then.
And we're going to write down everything that happened in the incident report.
Oh wait, no,
And
you start.
clinician two's vitals.
Yeah.
Everything else.
Yes.
She took. We'll also put that in the incident report. And Miss Ashley would like to be dismissed.
Yes.
So, some questions. So, first question is name as many, or how many can you name of the
Symptoms.
Okay, so another question would be, in what case would we use an injectable version of glucose versus an oral version of glucose?
So for our third question, it is simply just defining what is hypoglycemia. And we could also say, why did the patient have a hypoglycemic emergency?